In this video, I'm going to talk to you about a period of your baby's birth, which is really common, called transition. And then I'm going to lead into talking to you a little bit about the active phase of birthing your baby down the birth canal. Transition is very common and typically occurs when the cervix reaches around 8 to 10 centimeters of dilatation. And it's a point perhaps in birth where previously the lady has felt really confident and is really coping beautifully with her contractions. Maybe she's in the birthing pool, maybe she's using a little bit of gas and air, but she's really beautifully breathing through and finding everything manageable. And then she hits this period called transition. If you have a look at the slide, you'll notice that the contraction pattern can change a little bit here. So having gone through the irregular contractions of a piece of string, becoming more regular, maybe coming every 3 minutes, lasting a full minute. Maybe they've been coming more often than that, and every other minute. At transition, sometimes your body gives you a little bit of a break, and the contractions were maybe previously every 4 minutes, and then they ease off a little bit. But when they come, they can feel more intense and maybe last a little bit longer. Typically at this point of birth, you've maybe had however many hours piece of string, and then perhaps 6 to 12 hours of regular contraction. So physically and emotionally, your body has been working hard, but remember, as it's perfectly designed to do. A lady could hit transition and have a bit of a wobble in her confidence. So maybe the lady in the pool breathing beautifully suddenly has these more intense spiky contractions, and she might say to her birth partner, I can't do this anymore, I've had enough, I really can't manage, I need something stronger to help me manage, I want an epidural and I want an epidural now, okay? And the midwife will just be there and reassuring you that this is most likely transition, that there's some good signs there, that baby's really nearly here. This is the bit where I would advise that birth partners need a little bit of a thicker skin, but with major cheerleading pom-poms at the same time, okay? Maybe to this point she's found your support invaluable and really been amazed with how well you've done to supporting her. And this might be the bit where she maybe turns a little bit and says that you're not helping her very much and you don't understand, and that you don't get it and you're not helping, and I wish I had somebody else here. And get that midwife and tell her I want an epidural, okay? This is really normal, so just keep championing her and saying how amazing she's doing. This is a really good sign that baby's really close, you're so proud of her and she's doing great, okay? And then this period will pass, and then you're likely to feel a little bit more of an urge to bear down. The midwife will be closely observing what's happening, and as your body is passing this transition and your cervix has reached full dilatation or 10 centimeters, it may be that you're getting an urge to bear down or an urge to push. It could be that you haven't had that urge. Perhaps you've had a vaginal examination for some reason, and the midwife has found the cervix to be fully dilated, but your body isn't giving you any warning signs of this, and you're not getting that urge to bear down. That is really normal, and this is what we call a passive second stage, that we may happen to know the cervix is 10 centimeters or fully dilated, but that your body is happy to just keep moving around, being active, being upright, being forward, concentrating on long, slow, deep breaths. There's other ways that the midwife may be able to observe what's happening. As we've said already, transition, you may have a bit of a change in behaviour, which is a good signal that things are close. Your midwife might also ask to have a little look at your bottom, okay? This is certainly something I do as a practicing midwife. And by looking at your bottom, sometimes we can see that there's a good sign that baby's coming a little bit low. And you may wish to Google something called the purple line. And this is something, anecdotally, and through my experience as a midwife, I find is a good measure of being ready to birth your baby. So you may have a passive period of 1 to 2 hours. If you have an epidural in situ, then you're likely to have this 1 to 2 hours of passive second stage. And what's happening there is we're just allowing the power of your contractions to bring your baby's head a little bit further down before we then start to get you pushing more actively. typically as baby's ready to be born, and you will start to feel a little bit of pressure. It might be that you make a little bit more noise at this point, and typically this feels like you need to have a poo, and you feel quite a lot of pressure in your back passage, just like you need to go to the toilet. And you might make a bit of a guttural noise into the back of your throat, a little bit like this. And it's really more vocal than you perhaps have been throughout your birth, okay? And that's your body signaling to you that actually your baby's ready to come down. Now, it's not going to happen like it does in the movies or on a soap. This process is a gentle process of your baby navigating a slight bend in the birth canal, and may take between 1 and 4 hours. So 1 to 2 hours of passive second stage, and maybe 1 to 2 hours of a more active second stage where you're breathing your baby down or pushing your baby down. And what's happening in this process is the baby is gently navigating the U-bend. Okay, so they're coming down and round and under the arch of the pubic bone. As you get your contraction and you bear down, the baby takes a step forward, but then they just rest back a little bit. The next contraction, they come a little bit further forward and then slip back, but not quite as much as before. And again, I like to think that this is nature's way of saying to this baby, get ready, something's changing, and be ready for this. If they literally just dropped straight through, they'd be shocked and they wouldn't know what had hit them. Okay, so this is just nature's way of saying to baby, something's going to happen, something's going to change. Have a discussion with your birth partner about where you would like them during this point. Remember still to use those swing from the chandelier positions. So stand, squat, all fours, kneel, rest on the side in the bed. Again, upright forward open is going to have gravity on your side and is going to make the process shorter and more comfier than if you're laid resting on your back. So the midwife will support you and your birth partner will support you to find a comfy position. Have a discussion where you want them to be. So would you like your birth partner firmly at the top end and not having a look down below? Or actually, once there is something to see down below, are you happy for them to go and have a little look, okay? And you know, it always is great when perhaps a birth partner does go to have a little look, and then they come back and say to their partner, I can see the baby's head, okay? And then that's just really empowering and confidence boosting. Or perhaps you want to just have a gentle feel yourself, and again, just popping a couple of fingers down, you may be able to feel at the vaginal opening your baby's head, and you know, the lady says, oh my gosh, I can feel it, it's just sat there. And yes, it is, it's coming, and it's really nearly here, okay? Many ladies might worry about having a poo at this point. And what's happening, and what you have to understand, is that baby is almost pressing down against the back passage before it's coming up that other part of the J or part of the U. So actually, it might be that you do have a little bit of a poo at this point. And midwives actually love it if you poo, because it tells us that everything is working beautifully and as it's perfectly designed to do. And it tells us that baby is making that downward passage and backward passage. At this point, your waters have broken, so you'll have a pad underneath you soaking the waters up. So if there is a little bit of poo, then it's all very discreet and your midwife will just clear it away, and you'll likely never know that you did that. When I had my little boy, I'm sure I pooed, because most ladies do, but I was just so focused on what I was doing and who I was going to get to meet really, really soon that you're not really aware of that. If you're in the pool, we have other means of removing poo, so don't panic. We will sort that for you. You just are going to focus on what you're doing. Still keep using hydration, still keep having some high energy snacks, maybe some chewy sweets, typically something that is really easy to chew, okay, like a jelly baby, easy to chew and swallow, so that if your contractions are coming every couple of minutes, you've had chance for a drink, you've had something to nibble on to give you a bit of energy, okay? So as your baby starts to move around the birth canal and comes a little bit lower, we'll be able to start to see the top of baby's head. So you'll have to use your imagination a little bit with this. So if you imagine this is the labia, and your back passage is here. And this bit of tissue here is called the perineum. And this is the skin and all the muscles behind it. And the perineum is part of the pelvic floor, and it's that hammock of muscles that supports your abdominal organs like the bladder and the bowel. It also supports the weight of the uterus and your baby growing during the pregnancy. As we start to see baby's head appear, it will start to come forward, okay? And then remember, it might make that little slip back. The next one, it will come a little bit further forward, but not quite so much, until we get to the point of what we call crowning. So this is the widest part of your baby's head about to be birthed. And how is this going to feel? So it might feel a little bit stingy, but what the midwife is going to do is to help you find a position that's comfy. And we will ask that if you are not in the pool, if we can just gently pop a hand there with a warm pad, and the heat and the support of some pressure there helps that process feel a little bit comfier. We might even pour a little bit of warm water, that can help as well. If you're in the pool, then the warmth of the water provides that comfort and the support that the pressure of our hand would. And what the midwife is going to ask you to do is just to very, very gently breathe your baby's head out. Something else that you may wish to do to help prepare the perineum for birth is you may wish to do some perineal massage. The instructions for perineal massage are on the HDFT website under maternity and patient information leaflets. You can do perineal massage from 34 weeks of pregnancy, and it's a means of just gently stretching or preparing these perineal muscles for birthing. You may wish to start practicing maybe in the bath when you've been soaking in the bath for 5-10 minutes and everything's a little bit more supple down below. Or you could do it on dry land, maybe resting, relaxing on your bed, and maybe using just a little bit of water-based jelly to help you get a little bit of lubrication. It's thought that perineal massage may reduce the chance of having a tear down below. It's a difficult one to say because you could practice routinely doing some massage and have a small tear. You may not do it at all and not have a tear, but you'll never know. If you're going to choose to do some perineal massage, it's important that you don't have any vaginal infection like thrush or herpes, and that you are confident that your waters haven't broken, because to do the massage with your waters broken or with vaginal infection can increase infection risk. But otherwise, then give it a try. So that's another means of helping this process. At the point your baby's head is ready to crown, we just want the power of your contraction to deliver baby's head slowly and gently. So in the pool with the pressure of the water, or on dry land with the pressure of a warm pad, the midwife will just ask you to kind of blow your contractions away a little bit, okay? So the next contractions come in and I really want to push. Try not to push, just breathe, okay? So we're going to ask you to blow a bit like blowing candles out on a birthday cake, okay? And you'll feel the power of the contraction just slowly and gently deliver your baby's head without any added power from yourself, okay? And just like that, you've delivered the widest part of your baby, and baby's head is delivered. What's going to happen then? Well, your baby, if you happen to look, will then rotate their shoulders into a better angle for delivery. Now, it's a bit difficult to demonstrate this to the webcam with just two hands, so bear with me. What will happen is as your baby makes that rotation, you'll get a break in your contraction. And then the next contraction will come and you'll get that urge to bear down again. And what will happen is the midwife will just gently pop a hand either side of baby's head so we can guide them, their shoulders and their body around the rest of that J shape or that U shape. I can't do that with just one pair of hands, so I'm actually going to hold my baby's head like this, but we won't be doing this in real life. It'll be one hand gently each side. So your next contraction is going to come and we'll say, go on then, give us a good bear down, and we're going to guide your baby down, 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 down until the top shoulder's released, and then we're going to guide your baby up. And just like that, our baby is born. we'll really encourage you just to follow your urges at this point as well, okay? So some ladies get that really powerful urge to bear down. Other ladies might have used some hypnobirth to prepare, which has taught them to kind of just focus their breathing in a J kind of shape, and that actually they just keep breathing until typically their baby's head does hit the pelvic floor, and it gives them that I want to bear down and push, okay? So what's our baby going to look like? So before you say it, hopefully prettier than Clive, okay, my lovely teaching baby. But baby is likely to be a bit purpley blue, okay? They're not going to be rosebud pink. They're going to be wet. They might be covered in a little bit of mucus and a little bit of blood, okay? Remember, at this point, they're still attached to the cord, so they're still getting blood and they're still getting oxygen. We know that the best thing to do for your baby to help them make the easiest transition of life in there to life in a new environment is to bring your baby up into skin-to-skin contact. Skin to skin is great for babies and lovely for mums as well. So unless you ask us otherwise, we'll likely bring your baby up here onto your chest. If you don't want that, then just let us know, pop that in your birth preferences, and we can give baby a dry and a rub off first. But most mums are very happy to bring their baby straight up to here. We'll then cover the baby with some warm towels and just very gently dry that baby off, okay? And within 60 to 90 seconds, that baby is going to start to breathe spontaneously. Some babies cry, other babies don't. Some babies are really chilled and relaxed, and they come out and they just sort of start to breathe spontaneously and pink up beautifully without giving that cry to begin with, okay? Skin to skin has many benefits, but it's going to help to keep your baby nice and warm. It's going to help regulate their heart rate and their breathing rate. It's going to help your baby stabilize their blood glucose and to keep their stress hormones low. And it's going to help our baby to begin to explore our facial features, and it's going to help us to have that rush of feel-good hormones as well, and to get to explore and see what our baby looks like. However you plan to feed your baby, we would encourage 1 hour at least of uninterrupted skin-to-skin contact with mum until baby's taken its first feed. Many babies that are breastfeeding, if supported in this position, will kind of wriggle and nuzzle and move down and find their way to the breast. Other babies are a bit more vigorous and will actually throw themselves down because the power and the instinct to want to find the breast and feed is so strong. If you're choosing to bottle feed, then we'd encourage mum to give that first bottle feed in skin-to-skin contact still, to have that lovely mutual gaze with your baby. After you've had some skin-to-skin, then it's lovely for your birth partner to enjoy some too. And in our next video, we'll talk a little bit about how the placenta will be delivered. But easy as that, you've had your beautiful birth and your baby's here.